Outstanding, and what an inspiring start. I know Alondra would be happy to take some questions or comments. Yes, Tim.
Yes, thanks so much, Alondra. So good to see you again. Great talk. Thanks for all your work, your service. I wanted to just pull out one of the issues you were talking about. And the goals of increasing equity, it was you mentioned in one slide, how do you engage with the public voice? And that's been an easy to say but harder thing to do in terms of how that could be done in some way, especially when there's an information asymmetry between what the public may know or perceive about a technology. As you know, there's a lot of fear, for example, in AI, driven by the cool movies that we all love, but it's not the reality, and as an example. So how might we better, as we think about the future we want to build with equity, better get the public voice in this particular process? Thank you.
Yeah, I love that question. I mean, I would go back to this. This is often the slide I show for and other purposes for this point, which is AI is such a tremendous opportunity for public engagement, believe it or not, because this is December 2023, 6 months prior, 6 years prior, those of us who work in this space, if you said at a dinner table, I work on AI, all eyes would glaze over. It became a public issue. Like, it is a national policy issue now in ways that are sort of profoundly shocking to me. And so I think we now have an opportunity to engage the public, but to your point, there's a lot of fear. I think the polling, there's KPMG polling, there's Edelman Truth Barometer polling, Trust Barometer polling, like the adoption rates and the like lack of trust is bad. And so even if we think that AI is going to help with health outcomes, we've got to your point, get people, a lot more comfortable, and there's a lot more work to do. I would also say, I would remind all of us that last summer we had a strike of screen actors and writers around AI, which was like fascinating. I don't think any of, most of the people in that community think they're experts on AI, but they do appreciate that they're experts in how they want the conditions of their work to be. So what we learned in doing the deliberative process for the AI Bill of Rights is that once you get people slightly disenchanted with the technology and certainly not intimidated by it, you can talk to them about what it might do and what it means for their lives. And so I think shifting it from, you can't have this conversation unless you can recite to me the OECD definition of AI, to this is what this might mean for your life or for work or whatever, how you want to talk about it is a way that we can engage the public. But I think, also just coming down from on high, and being willing to have conversations with people.
I know many of you, but please introduce yourself, just a brief who you are and the question. I think it starts with Gil over there.
Thanks very much. Alondra, this is a wonderful period of work you've already invested in.
Gil?
Oh, Gil Lohman, University of Michigan, NAM member. So these are all laudable goals, and I think there's hardly any disagreement in this audience. But it does bring to mind that our IRBs typically say that we need to put the language of informed consent into documents at 8th grade reading level. And we used to wring our hands about using low-income or minority populations or any particular populations who could sort of be cajoled into being in a study as guinea pigs. Some people say now we use the wealthy people as guinea pigs because they get first access. How do you think about these old questions?
I think, IRB is quite imperfect, but it's better to have it than not. Being from a community that has been, historically used as guinea pigs, I get that. I think that there's nothing, I think we should have public documents should be at an 8th grade reading level. That was our goal with the AI Bill of Rights. That was literally the goal that we were trying to reach. And I think it is incumbent upon, health organizations, certainly the federal government, to be able to convey and communicate to the public, effectively. And so we still have a lot of work to do about that. I know Victor there's doing work here on public communication around health and science, and we don't do it well, but it's, I think, our responsibility to do it. And that people should be able to understand. And if they can't understand, again, most of us don't understand AI and it's highly complex. They can you can convey to them what the stakes of a technology or science or an application or a clinical trial are, broadly for their lives. But that falls to us to do that work.
Thank you so much, just for the wonderful talk and the challenging. Keith Walu, Princeton University. I'm sorry.
Not to be confused with Keith Yamamoto.
That's right. Nobody pays attention to the rules. I had one question that may about misalignment that may deepen and even more complicate the question of the challenge, and that is, in some ways, you could argue that Compass is actually very well aligned. The reason why it has found resonance and utility is because it's aligned with certain kinds of values.
Yep.
You can argue that AI, ChatGPT, is in fact very well aligned, and so I wondered how that way of thinking maybe deepens the challenge.
I think you're exactly right, but I think what this moment raises, Compass and the ChatGPT moment, is that we've not posed that question. So maybe I should have put on the slide misalignment question mark is more what I mean. Like, how do we begin to actually take that up as a question instead of assuming, as we have, and I think it's not wrong, that the sort of 4 or 5 Belmont principles are what we mean by alignment of, bioethics in a particular kind of scientific practice or application or something. So I think I would just agree with you and offer back that it's, I'm trying to offer a new, I think, empirical space for us to ask questions about as we think about digging in around issues of equity and innovation. I can do it.
Yeah.
Okay, I can do it. You can do it.
Johnny Piedimonte, I'm the Vice President at Tulane. What fascinates me is that I participated to several AI meetings in Europe and in the United States. And the focus is sharply different. In particular, in Europe, they are terrorized by the impact of AI on the work market. Mm-hmm. There is a report by Bard and Co. Actually, it's pre-COVID. I think they're updating it shortly, predicting that by 2025 we will lose about 1/4 of the jobs in existence. I think in the United States it will be even worse because 25% of the jobs are based on people driving cars or trucks, and that is literally something that's going to disappear very soon. Instead, in the United States, I never hear about that. I never hear about what's going to happen to the working people, to the people who put food on the table by flipping burgers, that are going to be replaced naturally by robotics. In Europe, they have already come up with their ethic committees and with their rules. They actively talk. In France, actually, they're talking, is going to be launched very soon. In part, is launched the 4-day work week. They seriously talk about universal salary. All those things do not appear to concern the United States. How do you read this? First of all, are you concerned about these issues? And second of all, why Americans don't particularly think about it?
So yes, I'm concerned because we're about to have a big social transformation, and we're not quite ready for it. And part of that big transformation is going to be around work. There's obviously conversations and some circles about having in the U.S. a universal base of income, great. But what work does as a sociologist is so much more than that, right? It anchors communities, it creates social networks. It's like, it is one of the foundational things, pillars of society. And so as a sociologist, I'm deeply worried and concerned. I would say you're right about the United States in the sort of self-driving car kind of automation phase. I think that there was less conversation and concern about, worry about that. There's a a nice book by a Cornell sociologist, Karen Levy, who writes about that sort of automation cycle. But I think, the McKinsey Global Institute turned out to be right. Like, jobs were shifted around. Automation didn't totally kick people out of work. We know that, Tesla's having some challenges with its self-driving cars. Where I would disagree with you, and this is why I mentioned the SAG-AFTRA and the Writers Guild strike, I would also, for this particular conversation, mention the National Nurses Union, which is right now engaged in a big sort of campaign and movement to think about what the introduction of AI into medicine means for their work as nurses. And there's been some good reporting in the Wall Street Journal and elsewhere about this. So I think people are very concerned, a lot to the extent that we've got polling data on public attitudes about AI in the United States. It is more negative in the United States than it is in a lot of places in the world. So there's comparative data. I think this might also be the KPMG data. So the people in the United States are more pessimistic about AI than people in India, China, South Africa. And part of that is around concerns about work. I mean, that is one of the sort of primary concerns. So I think it is, we've come later than I think colleagues in Europe, but is very much part of the popular public discourse around the stakes of AI. Alan, yeah.
So I'm Alan Leshner. I'm unemployed, but I
except for you have like more jobs than any of us.
Yeah,
somehow.
I used to be at AAAS. So I loved that you raised among your questions, do we want to use it? Which for me then raises the next piece, which is that the answer to that is not going to be unanimous. That is, we're not going to get absolute agreement on it. So who's in charge? That is, what if the answer is no? The majority of people don't want to use it. How do you stop it? Who controls it?
I think this is exactly what I was getting at on the sort of governance ecosystem that we used to have to govern these things. So I think the example of this is like no one asked for this, and here you come, right? I think the vernacular would be like, no one asked for you to come, and here you came, or something that the young people would say. And so, there's just going to be more of this, and it can fall to government in some ways, but we're having a challenge with AI governance, and the United States has an asymmetric advantage with AI, both in the market and lots of other ways. And so, we're going to be hard pressed, I think, to get governance around this for a lot of different reasons. I do think because now the public is engaged, that the consumer is important in a different way. That the consumer, this polling that says the American public is upset, the acceptance rates are low, the trust rates are low. I think particularly businesses that are not the AI labs, but are thinking about using AI, that worry about sort of brand and their sort of public profile. So you think about big S&P 100 companies that are going to be using ChatGPT or whatever on the enterprise scale. Like, they don't want their customers to be scared off. They don't want them to be intimidated. They don't want them to deal with hallucinations and other kinds of bad technologies. So I think I feel like there's a kind of bifurcation in the business space around this, because on the one hand, businesses very much want to move ahead, including a lot in sort of with health technology, but you can't, hurt your patients, and you don't want to damage your brand by using a system like, there's the Air Canada case, for example, that used a chatbot that sent bad information to a customer and then went to court, and they said, well, the chatbot said that, we didn't say that, it was bad information, and the Canadian court said, you actually have to pay this person because this is you, it's not just the chatbot. So those kinds of cases are sort of bad for, I think, business bottom lines, and so there's a little bit of traction there. There's a little bit of traction with the public. I just have been rereading President Kennedy's 1962 Consumer's Bill of Rights and sort of thinking, about the consumer in this place as well. I've also been thinking, I'm on this UN AI body, about the Universal Declaration of Human Rights that includes an article that says there's a right to science, so there's a right to discovery, but also to not being harmed by science. So I think there are kind of new we have to be, I think, a lot more innovative in how we think we can sort of rein, harness, steward, leverage these tools. Yeah.
Thank you, Alondra.
Thank you.
A round of applause.